it is the time of year when young adults are off to college or making their way into their first career, and there's a very important aspect of moving into adulthood, and that's making the transition from pediatric to adult health care.
Yes, Madison Miller is a 23-year-old who has just made the transition, and she's joined by Lucille from CVS Health to share some tips to help you plan for your child's future. Thank you for joining us both.
Hi.
Thank you for having us.
Yes. Madison, can you maybe share a little bit about your story and some of the challenges that you've faced as you've prepared to take charge of your own health care?
Of course, I have cystic fibrosis, which is a chronic genetic condition that primarily affects the lungs and digestive system. And since birth, I've had to manage this condition through a daily regimen that includes several medications and specialized medications and routine clinic visits and making space for self-care. And I have faced challenges just in taking care of myself and showing up, making the effort to show up every day. And as I transitioned into adult care, learning how to manage my health and take full responsibility came with the challenges of learning insurance and getting to know my medical care team and my pharmacist and learning how to refill my prescriptions and schedule appointments and attend those appointments. And I can say that by taking action and educating myself, that I've developed the confidence to stand on my own and take charge of my health care.
Amazing. Love that story.
Yeah, absolutely. Lucille, let me ask, whether or not a young adult is dealing with a chronic illness, why is it important for them to understand how the healthcare system actually works?
When transitioning from pediatric to adult care, and especially in healthcare, it can be quite daunting for our adolescents. And so what we encourage is empowerment, getting them comfortable. It brings out better outcomes for them by giving them that confidence, right? As you heard with Madison, she's definitely much more confident now in managing her condition. And it's complicated, especially with cystic fibrosis. And so getting to know your medications, how to take them as directed by your doctor, staying adherent, which means, taking the medication as needed and as directed. And then also just getting comfortable with your local community pharmacy, the pharmacist, getting to know them. That's important, especially when you're in a new area or a new job location. And on top of that is, as Madison mentioned, know your insurance plan that you have, understand the different intricacies that are out there, and then understand if you do have a condition like Madison that's chronic and needs special care, knowing that you have a specialty pharmacy can also help you with that transition and capability of being part of your care team.
Sure, yeah. And Madison, what lessons did you learn that could help maybe other young people as they are transitioning into adult health care?
Essentially, I learned that building a supportive team that I could lean into is very helpful. And that involved family and friends, getting to know my new medical care team, the pharmacist as well, and also connecting with others who have the same condition. And educate yourself on what tools and resources are available for you. Use the search engine and move forward, knowing that it's okay to ask for help, even if it feels like an act of bravery. And create the space to take care of yourself and know that your health care is important and it's worth making time for.
Yeah, absolutely.
Oh, yes. Thank you both so much. Where can people go for more information?
Well, they can go to cvshealth.com. They can also go to their prescriber. There's many patient support groups out there depending on the condition, and also even foundations. So definitely look into any one of those and you will get enough information to get you started.
Great. Thank you both so
Yes,
much for joining us.
thank you so much.
Thank you.
Yes.